everybody, we are going to talk about the gynecological exam. So it is recommended that women start seeing a gynecologist between the ages of 13 and 15. And the reason for this is they actually want patients to be seen prior to sexual intercourse. So it's important to express this with our teenage patients that they need to start looking for an OBGYN before their first sexual intercourse. So the exam consists of 4 different parts, the first being the breast examination. So the physician will actually palpate and feel the breast, look for any abnormalities, any tenderness, any dimpling, any signs of breast cancer, any abnormal discharge, things like that. There will also be an inspection of the external genitalia. So they're looking at the vagina and the anus, the rectum. They're looking all down there at the external genitalia to make sure there are no abnormalities. They will then do a pelvic exam where they're actually looking inside the pelvis, inside the vagina. They're taking a look at the cervix. So is the cervix opened, closed? Are there any abnormalities to the cervix? And then a rectal examination as well. So it's the role of the medical assistant to set up the room, including the tray and any equipment that may be necessary for the physician. So the provider may also require your assistance during the exam in order to make sure that the patient is comfortable. So especially with male OBGYNs, they require that a female be present in the room with the patient. So a lot of times the medical assistant is a female and perhaps the OBGYN provider is a male, so you will actually be in the room while this gynecologic exam is being done. And it also helps in laboratory specimens. So like with pap smears, the physician will take the smear of the cervix and then hand it to the medical assistant because they're still completing the pelvic exam. But they'll hand that swab off to the medical assistant for them to properly get it ready for processing. So assisting with the gynecologic exam, you're going to obviously perform the exam setup with the appropriate equipment prior to the exam. You may need a special lamp. A lot of times these are already in the rooms for these patients, but if your physician does more than just regular exams, then it may be in a different area and you may have to grab that. A stool for the physician to sit on while they do the pelvic exam. A Mayo stand, this is the type of stand that you'll set the equipment on. Gloves, lubricating jelly for them to put the speculum inside of the vagina. A pap brush or a spatula, this is for pap smears, for them to complete that. And if you start working in the specialty of OBGYN, you'll be specifically trained on all of these items, but it is important to kind of know and have heard of these things previously. So you're going to prepare the patient, you're going to have them undress, and remember we're going to be assessing their ability to do this. Most of our patients, adult patients, are able to get undressed themselves, but if it may be an older patient, maybe they've just had recent surgery, you may help them get undressed. They're going to put the gown on, and most OBGYN offices want them to have it open in the front. This makes it easier for access for that breast examination and for the external genitalia. And then explain how to be positioned for the exam. A lot of times they'll ask the patient to just sit on the edge of the examination table until the physician comes in, and then they'll ask you to lay back on the table. During the procedure, you may be positioning the patient and helping them into the lithotomy position. You may be adjusting the lamp for different lighting. You may stand by the provider to assist with the cervical specimen, as I mentioned, that swab. Applying lubricant to the provider's fingers may also be your responsibility. They put on sterile gloves, and at that point in time, they can't touch anything unsterile. And so you may be the one opening the lubricating jelly packet and putting it onto their fingers for the bimanual exam. So those are some of the roles of the medical assistant in this examination, and so it's important to understand this, especially if you're interested in working in this area.